All right, so this is the beginning of video number 4 for the Fluid and Electrolyte chapter 76 in your Rosedal book. We're going to be talking about assessing your patient for fluid and electrolyte imbalances. Some things that you're going to do in your assessment. We always begin our assessment with our vital signs as a baseline. So when you're looking at your vital signs, somebody with a fluid and electrolyte imbalance, you're going to want to pay special attention to their pulse rate, their respiratory rate, and their blood pressure. Depending on their fluid volume, their blood pressure may be high if they have an overload, or it may be low if they have a deficiency in fluid volume. You're going to want to pay special attention to their skin sugar. Does it tint? Is their skin dry? Is it flaky? What does their mucous membranes look like? Are their eyes dry? Is their mouth dry? Is their nose dry? How are they breathing? Are there crackles in their lungs? Do they have fluid in the alveoli in their lungs? You hear the little bubbling sounds. Somebody with congestive heart failure or pulmonary edema, that's what you would expect to find is crackles when you auscultate their lungs. Look at their I&O. Are they taking in enough fluid? Are they putting out enough fluid? Assess their urine color. Is it pale? Is it dark? Is it concentrated? Does it have a very strong odor to it? Are they constipated? Sunken eyes. In slide number 27, there's a picture of a child with very sunken, dark eyes, and that's a sign of dehydration. Their level of consciousness. If somebody has a sodium imbalance, UTI, something like that, they're confused. Is their heart rate? Is it tachycardia? Is it bradycardia? Do they have tachypnea? Know what those terms mean as well. I have a picture depicting urine colors from good to severe dehydration. Good is anywhere from almost a clear pale yellow, and severely dehydrated would be a dark amber color. If you have brown urine, that person is severely dehydrated or may have end-stage renal disease or going into kidney failure. On slide 27, there's also a picture, the child I mentioned with the sunken eyes, very dehydrated. There's a picture of someone with very dry lips, dehydrated, and a very dry tongue and mouth. So what do we teach our patients about fluid intake and output, and what do we want them to know to be better able to take care of themselves? So we want them to take in an adequate amount of fluid a day, but we also want them to be able to look at their urine and decide whether they are hydrated or dehydrated. A person who has congestive heart failure, you would want to teach them to do daily weights. So they would want to get on the scale at the same time every morning with about the same amount of clothes on every day. So the same time every day and record it. And generally what the cardiac doctors want is if they've gained 3 pounds in 24 hours or 5 pounds in a 7-day period. So that's a good indication. If your patient's not able to get on a scale and weigh, they can measure their bicep in the same spot, or they can do a measurement around their umbilicus every day, and that's a measurement of fluid retention that the doctor can go by. So monitoring the electrolyte content, the food contents that they eat. Are they eating foods that have a lot of potassium in it? And are their kidneys working well enough to remove the potassium from their body or their GI system? You're going to want to teach them other ways that fluid is lost. Just our regular breathing in and out every day, we lose some fluid. We lose fluid through our urine. Our bowel needs fluids to create our bowel movements. Sweating. People that are outside sweating during the summer and working, and they're drinking enough fluid and they're still becoming dehydrating because they're sweating so much. So a lot of times those people will need extra fluids and electrolytes, Gatorades, Powerades, salt tablets, things like that. I also want to teach our patients that some seasonings with salt substitutes in them have a high potassium content, so they need to read those labels well, because those salt substitutes that have potassium in them can cause them cardiac arrhythmias. So you don't want them to use a lot of salt substitutes with potassium in them. They do make more salt-free seasonings now that don't have that potassium to replace the salt. So just tell them to be mindful and not use the salt substitute, because it may elevate their potassium level. I'm talking about fluid volume overload. So that would be your patient that has an overhydration or excess water. It could be because their infusion, their IV fluids were given too rapidly. It could be excess sodium intake. They could have heart failure. They could have an increase in their antidiuretic hormone. I know y'all learned that in anatomy and physiology about the hormones. And that could cause them to retain fluid. An excess accumulation of interstitial fluid, that is known as edema, and that can be in a local area, or it can be generalized throughout their body. So you're going to want to monitor that edema and instruct them measures to reduce edema, paying special care to fragile skin. You don't want them to wear restrictive clothing that's going to make indentations on them. And you're going to want to teach them to put their feet above their heart, and that way the heart doesn't have to work so hard, and it can get rid of that excess fluid a little bit easier. A lot of times patients who have edema will say that they have to get up a lot at night to use the bathroom, and this is because they're laying down and that workload on the heart isn't as much, and so it's easier for that fluid from their legs and their feet to be recirculated into their heart and gotten rid of. So they'll get up more at night and use the bathroom because they diurese easier at night. All right, how do we measure edema? We use the 1 to 4 scale, +1 to +4, and it's either pitting or non-pitting. The term anasarca is a generalized edema throughout the whole body. Non-pitting edema is when you assess your patient and you put your fingers on the patient and it does not make that indentation. The pitting is going to leave that little indentation with them, and both are measured on a scale of +1 to +4. Some causes of edema could be the patient could have heart disease, it could have poor vascular circulation, could have liver disease, arterial dilation, they could have poor lymphatic drainage, renal disease, it could have low protein levels from anorexia, malabsorption disease, and it could be a respiratory disease that causes some pulmonary edema. Slide 34 has some pictures of edema, pitting and non-pitting, pulmonary edema, and swelling in the lower extremities. So a fluid volume deficit would be not enough fluid in the body. That would be your dehydration. And that always has electrolyte changes with it. Some causes would be inadequate fluid intake, excessive sweating, prolonged fever, GI suctioning, excessive urine output, renal failure, endocrine disorders, diabetes. There's a nursing care plan in your chapter, and I'd like for you to review that nursing care plan. And there's going to be an assignment, and it's going to be embedded in these videos that you're watching. And within the videos are going to be questions. So the first question is going to be, what electrolyte imbalance is Kayexalate used to treat? That's the first question. The second question is, what fundamental components are on a chemistry panel? Number 3, what is the name of the diuretic discussed in a prior video that can cause a depletion of potassium? So there will be 10 total questions embedded in these videos. Those are the first 3. So the next 7 will follow in the following videos. So this is video number 4. Stay tuned for video number 5.